Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science. Today we are going to see a topic on trays and gallipots, which comes under Central Sterile Supply Department, assembling and packing. The major role of the CSSD team is to assemble the surgical instruments in a tray and to do a proper sterilization technique. For this, the instruments has to be placed in a proper tray which has to be perforated and flat. It should not cause any damage to the surgical instruments. As well as you have a small metal and plastic bubbles for placing of fluids. This method of using a gallipots and the trays will help the equipment to be placed in a safe and secure manner, as well as it is helpful for the proper sterilization technique, as like gaseous method of sterilization like ETO have easily passed through this gallipots. What could be the challenge that can occur in this using of trays and gallipot is incorrect conclusion or incorrect inclusion leads to over delays, that is operating room delays, contamination risk. If you place more amount of surgical instruments on the gallipots, it may have a dump-like structure. It will lead to an irregular sterilization process. So here I am empathizing what is the importance of the technical team, like nurses is thinking of as trays too bulky for minor packs or gallipots missing in neurosets. This could be the emergency reason. The observing time is time lost searching a gallipots, tray damage in autoclaves can happen. The key insight is there should not be any mismatch between the pack contents and the procedural demands. So assembling is a major thing that has to be done before sterilization. If your assembling is delayed, automatically the sterilization process as well as the placing of a gallipots can also be affected. So the problem statement here is, how might we sterilize a tray or a gallipot inclusion to reduce or repacking by 30%. So the CSSD packers, they need a speed and accuracy. They should have a proper knowledge of how to assemble the surgical instruments. And you have to be very cautious to deliver the instruments properly to the surgeons, nurses, and for proper sterility. The metric has to be set here to properly analyze the condition, like packing assembling time, error rate, autoclaving load efficiency has to be monitored. What could be the ideal stage to actually what can be done for a proper specific procedural templates is, you want to create a template where that you can able to know what are the surgical instruments is present there, and also you want to know the size of a trolleys so that you can assemble the equipment accordingly. And you want to see whether what type of tray we are using, like lenticular for forceps, mesh for drainage, and gallipot size for 50 to 250 ml. According to the surgical needs, we have to assemble it. So what are the tray types present is perforated, solid, lenticular wire, and placement. The perforated trays are used for steam penetration, that is autoclave and ethylene oxide sterilization. For solids, we are using minor sets with delicate items. For lenticular or wire type of trays, we are using for endoscopes and heavy drainage. And for placement, these heavier items or bottoms and avoid overloading. This is a major thing. You should not overload the trays or gallipots, as that may also a reason for improper sterilization. There are certain specifications are available for the gallipots. Here are the size. That is 50 ml, 100 ml and 250 ml are the various sizes of gallipots. So the material makeup is mainly of stainless steel for proper heat absorbing capacity and heat sensitive. And certain use of ophthalmic, neuro and minor surgical packs are also present. And silicone mats are preventing a sliding. That is a main fixation. So summary I am here to define is about trays is of two types, like perforated or plastic, and gallipots is of different size of bowls. The purpose is for surgical organization that helps for the surgeon to facilitate and take the instruments for proper need of surgery. It is also helpful for the nurses to assist the doctors during the surgical procedure to take appropriate instruments from the gallipots or trays. It is not only an advantage, other advantages are the trays and gallipots helpful for proper sterilization, assembling of equipments, and for proper receiving and using of an equipments. The various tray categories are perforated, steam, solid and delicate, lenticular and bottom heavy placement. The quality control is overall taken over by the CSSD department, as they have to inspect the condition. They want to see check the protocol after post cycle of autoclave. Weekly biological test has to be taken, and they want to reject any criteria if there is an improper sterilization has been noted. These are the things. Thank you for listening. Hope you have understood this topic.